Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a podcast series nurturing bonds, experts, insights on breastfeeding. This podcast series aims to educate and support breastfeeding mothers and their families. This year's theme is Closing the Gap Breastfeeding Support for All, which resonates deeply with our mission to provide comprehensive support and awareness for breastfeeding. To celebrate this week, today we have with us as our guest Dr. Madhulika Sinha. She is senior consultant and HOD obstetrics and gynecology, a gynecologist at Aakash Healthcare Super Specialty Hospital. Dr. Madhulika has over 24 years of experience in obstetric and gynecology and has worked with several institutes of reputed like St. Stephen Hospital, Institute of Medical Sciences BHU, Max Hospital Pitampura, and many more. Dr. Sinha completed her certificate course in ultrasound from the Institute and Ultrasound of accredited by the Federation of Obstetrics and Gynecology Society of India, that is FOXY and IMA. Welcome to our show, Dr. Sinha.
Thank you.
Thank you so much for coming to this platform and giving us and ready to share your knowledge and expertise with us. Uh, Ma'am, moving on, I would like to start that given your expertise in high risk pregnancies, how do you counsel and support new mothers in these cases when it comes to breastfeeding?
High risk pregnancy means usually they have advanced maternal age or they have associated comorbidities like diabetes, hypertension, and usually these patients uh, they deliver most often by cesarean sections. So they these factors, they don't motivate them as much to breastfeed their babies. So we need to counsel them right from the antenatal period that whatever the comorbidities are like hypertension, diabetes, they cannot deter you from breastfeeding your baby, and these are not even contraindicated. So because they usually have cesarean deliveries, it is a painful thing and they don't get motivated enough to breastfeed, because breastfeeding is again a painful part in the beginning when they don't know how the baby will latch. They are not ready to accept that they are feeding their babies properly. They have a lot of anxiety, and anxiety is the factor which does not which also diminishes the milk letdown factor. So the this already again creates a vicious cycle, and this diminishes breastfeeding in them. So we need to motivate them we need to reduce their anxiety that it is very natural. Everybody can breastfeed. Advanced maternal age is not a contraindication that you should not feed, and each age group can feed their baby, and there is no contraindication for their breastfeeding. So we just need to reduce their anxiety, and that is uh, all we can do for them.
You said it right, ma'am, because that anxiety creates a lot of pressure and irrespective of breastfeeding or not, but under pressure, sometimes we fail to perform. So
Yeah.
moving on, from your experience, do women who have undergone infertility treatments face unique challenges with breastfeeding as compared to normal pregnancies? And if so, what are some of these challenges and how can they overcome this?
Conception through fertility treatment is usually associated with delivery of multiple births. Like they usually have twin pregnancies or a high order pregnancies, and again, this increases the chances of prematurity. This increases chances of cesarean sections, low birth weight babies. So these again they reduce the motivation of breastfeeding the babies. They have already gone through a lot during the infertility treatment, and having baby in their arms is all that they have imagined through. So now the task again comes, so how to breastfeed. So usually this makes them little demotivated, and they are already, and there is a lot of pressure also that you are not producing enough milk. The baby is small, baby is IUGR, baby is preterm, so there is a lot of pressure also on them. So
Hmm.
these pressures have to be reduced, and only I think the anxiety has to be reduced. And okay, it is better that baby will be in nursery and few days you may not be able to breastfeed them, but later on when the baby comes to you and the baby is okay by the according to the pediatrician, you have to breastfeed. And the earlier you try to suckle your baby, the better it is, because the baby also gets used to that. So this is the main problem which an infertility treated lady usually has.
Ma'am, thank you so much for explaining that so well to us and to all our audience, because uh, this helps us, the new mothers, the expecting mothers who have gone through this or they are going through this, will help them to be more aware of these kind of challenges. And also, ma'am, your career has been spanned more than 24 years. So, based on your experience, what are the most common misconceptions, myths you have encountered when you have talked to your patients about breastfeeding, and how do you address them?
Yeah, I have been telling my patients and their family also that you have to motivate the lady for breastfeeding. But sometimes I'm very disappointed when the same problem is occurring again and again. And in the last 24 years, we have not made the society so much aware. Like many people, they are educated, they come from educated families, but they have lot of misconceptions. Have lot of myths around the food habit, the dietary habit of the lady, or the lady who has given birth to a child. So आपको बस दलिया खिचड़ी ही खाना है, तो एक ही रोटी खानी है, तो this is a very common misconception that you have to eat plain food. Okay, we ask them to avoid spicy food, but the main misconception is diet. And I have seen people who have delivered, they come and cry that I'm not being given proper food, because they say कि अगर आप ये खाओगे तो बच्चे को लूज मोशन हो जाएगा, बच्चे को पेट में दर्द हो जाएगा, बच्चा रोने लगेगा. So this is a very common misconception, and I think this needs to be reduced. So I always ask the husband to come in front, and he is the person who can support his wife. So this is a very common misconception about the diet. And the other misconception is that misconception kya, people are always after her, बच्चे का पेट नहीं भर रहा है, थोड़ा सा रोया बच्चा, बच्चे का पेट नहीं भर रहा है, you are not producing enough milk. But I always remember a pediatrician used to tell me when I was doing my PG that nature is never cruel, nature is never harsh. The lady will produce milk whenever the baby is in her arms. The lady has to produce milk. Okay, the milk let down will be less in first few days, but after 2 to 3 days she will produce enough milk when the baby is in her arms. So the mother is always full of milk and she will provide. So ye anxiety has to be removed from the mother's mind. So this is also a very common misconception कि baby roya, baby को कोई भी problem हुई तो you are not producing enough milk. The other thing is that if you have fever, you cannot breastfeed. But remember, if you have fever, then also you need to breastfeed, because if you don't feed your baby frequently, usually the milk ducts, they get clogged, and this leads to additional difficulty in breastfeeding. You can have take a paracetamol and you can breastfeed, only because if you have a lot of, during COVID we used to say that even if you have COVID, if you are COVID positive, you should put a mask, you should use a disinfectant and feed your baby. So feeding has to be always there. Even if you have fever, you can take a paracetamol. Now, you cannot take any medication during breastfeeding. This is also a very common misconception which people have. So this is not right. Only there are few conditions, and very few conditions where some medicines are contraindicated while breastfeeding, and that we all know. And when these types of problems are there, we always tell the mothers that you should not breastfeed when you are taking this medicine, like chemotherapy or all. But this is not a very regular medications which a person
Yes.
is on. If you have loose motion, if you have diarrhea, you can breastfeed your baby, and side by side you can take medications also. So these are very few misconceptions that people need to be aware of, that breastfeeding is never contraindicated. Even a HIV positive mother can breastfeed her baby. In a developing country like ours, 6 months of breastfeeding is must. But there are few situations when the baby is not gaining weight, proper weight is not there, then a pediatrician can advise them formula milk. But the baby has to be given formula milk, and side by side the mother has to feed the baby also. So breastfeeding is never contraindicated, and never has to be reduced.
Ma'am, you mentioned about some of the foods that normally there's misconception that mothers should avoid while they're breastfeeding, like spicy food, ya dalia ek khao, sirf ek chapati khao. So, can
हाँ.
you give us some of the nutritional food which a mother should eat that benefits both mother and child during breastfeeding?
See, you can have all healthy diet which you used to take during pregnancy. Like you can take nuts, you can take high quality protein, eggs, you can take non-vegetarian diet, you can always take uh, dal, roti, and whatever we were eating during pregnancy, that has to be continued during breastfeeding. There is nothing like you cannot, even after a cesarean delivery, we advise them you can take a bit of ghee also, because people are very worried we can give ghee or not, we can give milk or not. So these are never contraindicated. Milk cannot produce stitch line infection. We always tell them you can have milk, you can have curd. Curd is also very good. It is a very good probiotic, and we can always give them. So you can have dosa, you can have idli, you can have rajma, chole, everything. But then if a lady is cannot digest something, because after delivery, usually for first few days they are on some antibiotics, they are on some painkillers. If she has a gastritis, if she is not able to tolerate some food, then she can avoid. But there is no specific contraindication that you should not take this, you should not take that. You can have everything whatever you were taking in your while you were pregnant, and you can have a good diet, healthy diet, all vegetarian, non-vegetarian, dry fruits. They are very rich in protein, very high energy snacks. And in fact, after each breastfeed, you have to keep a handy snack with you. भुने हुए मखाने हैं, soaked almonds हैं, you can always take them. And you can take small amount of ghee also. You can take milk. Milk is very important. And you have to have proper amount of liquids. And a very common misconception after delivery: don't take lot of water, because your stomach will never come back to your position. So this is also a very common misconception. You have to take plenty of fluids. You have to be well hydrated.
Thank you so much for shedding light on those misconceptions, ma'am, because it is very important to aware our listeners out there, the expecting mothers, the new mothers who is listening to this. And thanks for that. And ma'am, also, what are the top three recommendations for new mothers to ensure successful breastfeeding journey? And your final message for the expecting mothers as well.
Yes, I will always advise my breastfeeding mothers not to be very anxious. Don't come in to this that I'm not producing enough milk. You are producing enough milk for your baby, which is good enough. After 2 to 3 days, you have to go for a check to the pediatrician. The pediatrician will see that if the baby is gaining weight, your milk is more than enough. You don't need to switch over to formula feeds if the baby is crying, because baby will cry because of many things, है ना? But you are producing enough milk. You have to reduce your anxiety about that. This is the first message I would like to give to my breastfeeding ladies. Take adequate rest, because delivery is a very I think it is a mixed matlab, it has got mixed feelings. You have pain, you have so much of happiness, you are overwhelmed when you have baby in your arms. So reduce your anxiety, take adequate rest. Whenever the baby is sleeping, you also take rest, because rest is very important. Baby will have erratic sleep cycle, baby will wake all through the night, but you will have to wake with the baby. So take proper rest. Rest is very important. So reduction of anxiety, proper rest, and feed the baby frequently, and take care of your breast. After each breastfeed, you always have to take see whether your breasts are still engorged or not. So the breast should be soft after each feed, because if the breast engorges, if there is sore nipples, it will again be a deterrent for your breastfeed. So you have to be very careful that you keep your breast healthy. And you can always take a help of a professional if you feel that you are having recurrent sore nipples or cracked nipples. Might be your baby is not latching properly to the breast. So you can always take help of a professional lactation consultant. These days all hospitals have lactation consultant with them, so you can always take a professional help if you're not able to breastfeed, because this is built in a thing in a lady, that she has to breastfeed and you have to breastfeed. Okay.
Yeah. Thank you so much, ma'am, for explaining all those things so well in a layman simple term so that me and all our audience can understand. And thank you so much for coming to a platform for creating this awareness on breastfeeding week, which is from 1st to 7th August. It matters a lot to raise this public awareness, and without your help and knowledge, it won't be possible. And thanks again for giving your invaluable time to us.
Yes, Simran, and I will always say breastfed babies are the best fed babies. Breast milk is the best milk. So this should be in everybody's minds, and we have to remove these misconceptions, because this cannot go on and on and on. So this has to come to an end.
Correct. You said it right, ma'am. And this will come to an end through these kind of more such sessions and experts like you.
Thank you.
Thank you so much, ma'am. Thanks a lot.